MMI Topic 11, Epidemiology and Disease Transmission, Part B, Vector Transmission and Emerging Infectious Diseases. So from Part A, we were talking about disease reservoirs and disease transmission, how we get from the reservoir to infection, and we talked about contact transmission, and we talked about vehicle transmission. Now we're going to talk about vector transmission. So vector transmission means carried by some sort of organism between hosts. Usually we're talking about some sort of arthropod, so an insect or a tick or something like that. So there's two types of vector transmission. One is mechanical. So mechanical, it means the organism doesn't require the vector to be transmitted, and these are often associated with unsanitary conditions. So you can see in this diagram on the left, we have a fly here, and the fly is basically associated with some sort of fecal matter or garbage or something like that. It picks up the disease, and the disease is on the fly's feet or something like that. So this could be a fly or a cockroach. It walks over here to this guy's hamburger, and then the guy eats the hamburger, and now he's about to get sick. Often when we talk about vector transmission, we're talking about biological vectors, meaning that the disease has to be transmitted by that pathogen as a normal part of its life cycle. You can see in this disease here, you can see this woman here is getting bitten by that mosquito, and that mosquito is going to take whatever that parasite is and bring it to another individual. So things like malaria, West Nile fever, all sorts of vector transmitted diseases. So there's a few I want to talk about. So here's a bunch of those vectors. Some of them we've talked about already. We've got ticks and fleas and flies and mosquitoes and true bugs and all sorts of things. Some of them have 6 legs, that would be insects, and some of them are not insects. Usually they have 8 legs. So here's a list of vector-borne diseases. There are others. There are many, many more. In fact, I'm not even sure if I see Zika on here, which is, no, Zika is on here. But I do have 3 highlighted: West Nile fever, Lyme disease, and rickettsial diseases, so Rocky Mountain spotted fever. These are the number 1, 2, and 3 vector-borne diseases in Canada, and I think roughly in that order. And so these are the important ones to know. For this class, Lyme disease and West Nile fever, you must know about these diseases for sure. You can see there's a bunch of other diseases that we've talked about in this class: plague, African sleeping sickness, Chagas disease, and malaria are also on this list. So let's talk about Lyme disease. Lyme disease is spread by ticks. Notice how small they are. Take a look. There's a Canadian dime. You can see these are very, very tiny. Notice we have a poppy seed here. And the poppy seed is about the size of this here, which is the nymph. And this is actually the most important stage of the life cycle when we're looking at transmission of human disease. So these ticks are called the western black-legged tick, or just the black-legged tick. The black-legged tick here, this one here, is the one that is causing most of the transmission in Canada. You can imagine the western one is Western Canada, which really means west of the Rockies, and a lot less disease transmission than the normal black-legged tick. Also got the deer tick and the bear tick and the Lyme tick, and I've heard a bunch of other names. So black-legged tick is the most common name. Small as a poppy seed. Can you see them? There's a poppy seed bag out. Can you see the ticks? How about now? There's 5 of them. Ready? There they are. That's the question I ask myself. If I had something on my body the size of a poppy seed, would I notice it? Probably not. The good news is it literally takes them about 24 to 36 hours to establish themselves and bury themselves in your skin. And so if you do have a tick on you and you get it off right away, there's not any risk that we know of. So they recommend, if you are in tick-infested territory, to have a shower when you get home. Throw your clothes in the dryer. That will kill the ticks if there are any on your clothes, and that should be enough to eliminate most of the risk from Lyme disease. So let's talk a little bit about the life cycle of Lyme disease. The ticks here, you can see there's the name, Iodes scapularis, are often found on deer and mice. There's a deer with, it looks like, hundreds of ticks on its ears. Poor thing. And there's the ticks. You can see there's the nymph right here, and as they bite, they swell up and they take their blood meals and they get a little bit fatter. So you can see here's a swollen nymph, which is what we want to be looking for if it's found on our bodies or on our dogs. So here's a diagram of the life cycle. I wish I had it animated a bit better, but I'm just going to go through it quickly. You can see they start off as eggs, they hatch here, and they become larvae, and then, this is the important part of the life cycle, they find mice. Now why do they find mice? Ticks are not very picky. In fact, ticks, if you have blood, they will gladly jump on you and suck your blood. Mice are important for two reasons. One is they're near the ground, so they're easy for the ticks to find. And two, the bacteria that cause the disease can live in the mice, and the mice don't seem to get sick. So this is why this nymph here is the most important part of the life cycle for infecting humans, because they bite the mice, they can get the bacteria, they winter, they transform into these from larva into nymph. Notice we've got 6 legs to 8 legs, that's kind of interesting, and then they can bite the humans or dogs or other wildlife. Sometimes they bite deer, which is probably part of its natural life cycle, but usually they don't go from deer to biting human. Usually it's from the nymph to biting humans. And the deer also cannot really hold on to the bacteria as well as the mice. About 90% of the mice out there are infected, maybe 10% of the deer. So it's more likely to get the disease going from mouse to nymph to human. So let's talk a little bit about the disease. The disease itself is caused by an organism called Borrelia. And there it is, and you can see it's a spirochete organism, kind of like the organism that causes syphilis, and it can burrow into all sorts of tissues. And that's what makes it quite significant and serious. About 80–85% of people who get Lyme disease get this thing here. It's called a bullseye rash. And it really is like a bullseye. You can see there's a central part and there's a ring or rings around it. And sometimes the rash grows. It can start off very small and actually get very, very large. Often people will have the rashes near lymph nodes, so behind the knees or under the arms and places like that. And so if you have that rash, go get antibiotics. Go get them for sure. There's only one other disease on the planet that causes a similar rash, and it's also a tick-borne disease, believe it or not. So if you're lucky enough to get the rash, go get the drugs, and it is treatable usually by, I think it's doxycycline is the standard treatment, and you're good. You may experience other fevers in early Lyme disease, so fever and chills, it's pretty common in a lot of diseases. Sometimes headaches and fatigues, sometimes muscle and joint aches or swollen knees and things like that. So those are things that doctors are looking for now because not everybody gets this bullseye rash. And if you have reason to suspect that you've been exposed to Lyme disease, it's important to get the medication early to prevent the later symptoms. So what are these later symptoms? There are many. These organisms, they can travel to all sorts of tissues and cause various complications and issues. You can see some of them relatively minor, things like headaches or stiffness or joint pain. Some of them are a little bit more noticeable. Facial palsy, that means paralysis in the face. Various pains people have experienced. Some more serious like heart palpitations, nerve pain, and even mental problems like short-term memory problems. So where do we find Lyme disease in Canada? It turns out the ticks have been found all over Canada in all 10 states, and I believe at least Northwest Territories. I'm not sure about Nunavut or Yukon. But where does the disease normally transmit? You can see a little bit in British Columbia. Big proportion of the disease is over here in Ontario, Nova Scotia, and New Brunswick and Quebec. I'm not sure if it is found on Prince Edward Island yet. I'm not 100% sure about that. And some parts in northern Ontario and in Manitoba we're starting to see transmission now. Alberta, I'll talk about that in a moment. So here are the cases in Canada. We've actually only started recording Lyme disease since number of cases since 2009. And you can see the cases are going up quite significantly, most people believe. The most recent data I could find was 2017. Hopefully the newer data will come out soon. And you can see the number of cases in Alberta since 1991 that we know of have been 88 cases. So not very many cases of Lyme disease in Alberta, and at this point we believe all the cases have been imported, meaning somebody was traveling to Ottawa or traveling to the States, and that's where they got the case. That being said, there are a lot of people that have probably had Lyme disease and they didn't know they had it. That's the scary thing about Lyme disease. There are a lot of people who get it and don't get treated and don't know they have it. And some of those later symptoms, fatigue and aches, I mean, those are symptoms that could mean just about anything. So we've also been doing tick surveillance in Alberta for a few years now, and you can see here's some recent data. 2016, we have about 2,700 ticks tested, and 34 were actually positive for the bacteria. So the organisms are here, not probably in large numbers, but I'm guessing with global warming we are going to see more transmission and more cases in the future. So let's talk about the most dangerous animal in the world, the mosquito. Why is it so dangerous? Mosquitoes are killing people all over the world, particularly if you look at malaria. It kills a child every 45 seconds. So what diseases are we talking about? Many, many diseases. Here are just a few. You can see we've talked about malaria in this course. We're going to talk about West Nile fever because that is transmitted in Canada. You may be familiar with yellow fever or Zika or dengue fever, but there are many, many diseases transmitted by mosquitoes. So there are actually about 3,000 types of mosquitoes on the planet, and about maybe 300 will actually infect humans. Mosquitoes do have preferences. That's something interesting about mosquitoes. Turns out that they do like brunettes more than blondes and women more than men. There's lots of interesting mosquito studies. I believe there's even color preferences as well. One mosquito here you can see is the Aedes mosquitoes. These tend to transmit flaviviruses, so there's a huge list of tropical diseases there, Zika, yellow fever, dengue, that you may be familiar with. There's also the Anopheles mosquitoes, and these are most famous for transmitting malaria. That's the Plasmodium parasite. And the third group are the Culex mosquitoes. These ones love stagnant water. You can see the other name for the Culex mosquitoes are house mosquitoes. So they're associated very highly with human civilizations. We're talking about they can breed in eavesdrops or puddles or farm fields and ditches and things like that. The one that's relevant here is, of course, West Nile fever, which I want to talk about now. So let's talk about West Nile virus. I mentioned before that West Nile virus is transmitted or grows up in birds. So you can see here is the American robin. That's a pretty common bird found all over North America, found here in Fort McMurray. And you have the mosquito and you have the bird, and the disease just goes from mosquito to bird to mosquito to bird, and that's the natural life cycle of this disease. Sometimes though, maybe when it's hot and dry, the birds fly away and the mosquitoes are looking for other things to bite. And so they might bite humans. And it turns out that horses are actually quite susceptible to West Nile fever. So what kind of symptoms do you get? You get basically flu-like symptoms in most cases. So that means fever and chills and headaches and things like that. Sometimes people get encephalitis and leads to brain swelling, which can be actually very critical for older people, which is the main cause of death of West Nile virus. Most people, though, get a relatively mild flu-like symptoms or no symptoms at all. So where is West Nile virus found in Canada? Pretty much all 10 provinces. If you take a look in the east, there's actually one mosquito known, a Culex mosquito known as the northern house mosquito, that is transmitted in the east. And in the west, we have a mosquito called the western encephalitis mosquito that is doing most of the transmission. So the western Canada, that includes Alberta, this mosquito is one of those ones that really likes farm fields. It likes ditches, and water will congregate in the hoof marks of animals, and that's where these mosquitoes like to breed. It does seem to be spreading north a little bit, but this mosquito or this disease can get anywhere because, of course, birds migrate all over the place. So what about Zika? Well, thankfully the mosquitoes aren't in Canada yet. This is a map showing where the mosquito Aedes aegypti is found in the United States, our nearest neighbor. You can see we're looking at Florida, California, and a few of these southern states, with a few patches here and there of other places where the mosquito has been found. Believe it or not, the mosquito has been found at least once in Canada in a mosquito trap. We don't know whether that's an abnormality or whether it just was a fluke. Sometimes mosquitoes can travel quite far because, of course, they can ride on the backs of birds. So let's talk about nosocomial infections. This is another serious and significant form of disease transmission. So nosocomial means hospital acquired. Sometimes we use this term here, HAI, which means hospital acquired infection. This is about 10% of patients who go into a hospital will get a secondary infection if they stay there for a night or two. So what factors contribute to nosocomial infections? We're looking at the fact that the pathogens are already in the hospital. So you can imagine you've got lots of sick people and they're bringing in their germs. We also have transmission that happens in hospitals. So you've got visitors, you've got staff, you've got they're touching doorknobs and instruments and all sorts of things that can lead to further transmission of these diseases. A lot of people in hospitals are already sick. They may be old, they may have compromised immune systems. That makes them more susceptible to infections. And lastly, we have invasive procedures such as catheters and surgeries that can introduce the organisms into new anatomical sites. What kinds of infections are we talking about? The big one here you can see is urinary tract infections, but we're also talking about blood infections, respiratory infections, and various types of skin infections or surgical site infections. What organisms are causing this? No surprise, Staphylococcus is at the top of this list, but we also have other pathogens we talked about, including E. coli. We're going to talk about Pseudomonas. We've talked about Candida. There's the other Staphylococcus epidermidis as well. So what can we do about nosocomial infections? This will be important for you because you are probably going to be working in a healthcare setting as a nurse. So disinfection, good housekeeping, those things are important. Sterilization of medical devices, catheters, things like that. Isolation of infectious patients, so people with MRSA infections are often isolated nowadays to keep them away from infecting other people. Monitoring outbreaks, making sure that if there's an outbreak in a hospital that those patients are given extra care. Notice I have a sign there, effective hand washing. This is probably the #1 thing that can be done by everybody a lot better. And we're talking about a lot right now in this COVID-19 pandemic. So I want to talk about emerging infectious diseases. You can see the definition here. This means diseases that are new, or they're increasing incidence, or they maybe have the potential for coming and emerging in the future. So a lot of reasons why diseases may just pop up from various places. You can see one contributing factor here is increasing population densities. So in some places where lots of people are congregating, could be a variety of reasons, could be naturally cities getting larger, or people congregating, let's say, in refugee camps during war. You got more people, more possibilities for disease transmission. B, sometimes we get new strains. So in 2009 we had this H1N1 virus. This turned into a pandemic. This year we have this SARS-CoV-2 virus, which is a new strain, which so the human population is entirely naive, so we're all getting infected. So what exactly happened in 2009 with the H1N1? Well, it turns out that we actually had 4 viruses. There were 2 swine or pig viruses, there was 1 avian virus and 1 human virus, and all these viruses somehow basically infected the same cell. This probably happened in a pig. And the reason we know this is that pigs have receptors that look like human receptors, and they have receptors that look like bird receptors. So you had that antigenic shift that happened, and you got a little bit of mixing of all those RNA strands, and we get a brand new virus, and that brand new virus was able to infect humans and was able to infect pigs. So thankfully this particular pandemic turned out not to be too serious, and we were able to get a vaccine for it. And now, believe it or not, this H1N1 is part of the normal seasonal flu. So what about avian flu? Avian meaning bird flu. A lot of flu specialists are very, very concerned about avian flus. Turns out there are a few really highly pathogenic strains, and by pathogenic, anywhere from 10 to 30% of people are dying from this virus. The good news is these human infections are very rare, and they seem to be only from bird to human, no human to human transmission. Here's a little diagram showing how this might happen. So it turns out that influenza viruses infect the gut in birds and not the respiratory tract. So unfortunately, birds, chickens in particular, can be very messy, and their poop is all over the place. You can see this human here is handling the bird. Maybe he's a farmer, maybe he's somebody working in a food market in China, and he's fecally contaminating himself and getting into his nose or mouth. As I mentioned, chickens tend to be quite messy. You can see they're flapping their wings or shaking their heads and causing the virus to be spread through dust particles as well. Thankfully, like I said, this seems to be just bird to human and not human to human, but people are watching these things just in case. We never know when we'll get another H1N1, and hopefully it will never be as serious again as the 1918 Spanish flu. Here's a map of some of the various cases of the avian influenza that have popped up over the years, and you can see the cases are focused in places like Korea and China and Vietnam and Cambodia, and out of 700 cases over 10 years, 60% mortality rate. We know that the 60% mortality is actually a lot lower because we know there are a lot of people getting sick that are not going to hospitals. Still, it can be kind of scary. Here's this is a few years ago, 2015, and this is in Korea, I believe, and we have all these individuals and they are slaughtering millions and millions of chickens. You can see all these eggs are getting dumped out, and just out of concern that this flu may get transmitted to humans. So what other things? We've talked about also the production of superbugs. This can lead to extra transmission of these microorganisms when they are resistant to the drugs. The most important superbug, of course, is MRSA, methicillin-resistant Staphylococcus aureus. This one here, sometimes we're starting to see more in the scientific literature being called multi-drug resistant, which is a bit more accurate because methicillin-resistant Staphylococcus aureus tends to be resistant to numerous types of drugs, and it can be quite difficult to treat. You can see we're talking about a lot of open wound surgeries and infections, and also catheters and other bloodborne infections in hospitals. So people who have MRSA in hospitals now, they're often isolated in their own room, and you have masks and gowns and gloves, and usually a sign up on the door that will say this patient is being isolated, and extra precautions are taken to try to prevent transmission by fomites from MRSA. The number 2 superbug is Clostridium difficile. We've talked about Clostridium a few times in this course. Sometimes this is called C. diff, short form for Clostridium difficile. Difficile, of course, means difficult. And what is it difficult? It's difficult to treat with antibiotics. It turns out that it's resistant to quite a few drugs that are out there. So how do people get C. diff? They can get it spread from person to person in a hospital quite easily. For some people, it's part of their normal flora, and it also produces endospores. So this is usually the number 1 case of something called antibiotic-induced diarrhea. So how does this work? Somebody has an infection for something, could be just about anything. They take antibiotics, and what it does is it decimates their normal flora. So their normal gut flora, many of the bacteria are killed off, but the endospores are able to germinate and grow. And so Clostridium overgrows and causes a really nasty diarrhea. Unfortunately, this particular diarrhea can be quite foul smelling as well. So what other contributing factors? We can also have changes in weather patterns. There was evidence that Lyme disease is moving more northward, so maybe I should change that to climate patterns. Climate means more long-term rather than weather. Modern transportation, as I mentioned before, SARS made it to Toronto from one airplane ride. You can see that this COVID-19 pandemic has spread worldwide. in a matter of months. It makes it very, very easy for these organisms to travel overseas and across oceans. Ecological disasters, so we could talk about, and public health failures. If you look at what happened in Haiti during that earthquake that happened a few years ago, the amount of disease from waterborne infections spread very, very quickly. So what is this? Take a careful look. This is actually a map. This is a map of flights that are going all around the globe. So here's really the bottom line. Infectious diseases do not need passports. We can close all our borders and block all our flights, and we still have disease coming in because we are a connected world. We're reliant on supply chains. If you want those fresh strawberries from California, somebody's got to bring them across a border. You want goods manufactured in China, they're going to have to come over here on an airplane. Somehow these diseases transmit, and they do it very, very, very easily. So the last thing I just want to talk about is that, of course, for these diseases, to keep track of them, we have to keep records. So in Canada, we're looking at Alberta Health keeps track, Health Canada, Public Health Agency of Canada as well. Internationally, we have the World Health Organization, and also the CDC in the United States keeps track of a lot of infectious diseases that are being transmitted worldwide and, of course, locally. So if you take a look, here's a list of some diseases that are considered notifiable. This was the most recent data I was able to find. You can see some of these are just diseases that are preventable by routine vaccination. So mumps, pertussis, and measles. And you can see the number of cases in Canada in 2015 and the number of cases in Alberta. Sexually transmitted infections, enteric water and foodborne infections. So all of these things are usually preventable in some manner or another. So if we can track them, then we can maybe educate people or find the source and figure out ways to reduce their transmission. So a few more thoughts for you on epidemiology and disease transmission. First, there's been a lot of conversation about people washing their hands and touching their faces and those kind of things, and there's tons of studies, believe it or not, looking at college students and adults and how many times people touch their face, scratch their eyes, itch their nose, all those kind of things. And this is something we need to be cautious of when we're thinking about this COVID-19 pandemic. I can tell you, as soon as I went to the grocery store the other day, how many times I felt my nose was itchy and I had to resist scratching it because I was concerned about infection and I wanted to wait until I got home to wash my hands before I scratched my nose. So something to think about. Number two, a lot of respiratory viruses can survive out there on various things. This COVID-19 virus, it seems to be about 4 to 5 hours for most surfaces, clothing, money, those kind of things. Sometimes with mucus and excess moisture, some of these viruses can actually survive a couple of days or more. The flu virus in particular, with lots of mucus, has been shown to survive on money for up to 4 days. Turns out that with this COVID-19 pandemic, we got to get away from handshakes. So elbow bumps or fist bumps seem to be the go, or at least a little wave from 2 meters away is going to be probably the standard for the next couple of years. Lastly, hand sanitizers and wipes can be effective, but hand washing with soap for a good 20 seconds is definitely going to remain the gold standard. Wash your hands frequently. So this finishes topic 11. Let me know if you have any questions. Don't forget to go over your terminology and study questions. I hope you have a wonderful day and good luck on your final exams.